We were the first unit on scene. Fire had got on scene at the same time. And, uh, you know, one of the sickest group of patients that I've ever had. We realized as we extricated her out that the helicopter was overhead, but because of low-lying fog and the weather in the area, they could not land. I remember her airway was so bad. I had all the airway stuff right there ready to go. I almost intubated her right there on the road.
Hello, everyone, and welcome to the Paratus podcast, the Emergency Preparedness podcast. I'm super excited to have with us today Eric Bauer. Eric is the CEO at FlightBridge Ed and one of the most influential educators in critical care and transport medicine. With over 30 years of experience in EMS and more than 2 decades in HAMS, Eric has authored best-selling books, delivered nearly 100 international lectures, and built a podcast with over 6 million downloads. He's earned some of the profession's most prestigious honors, including the EMS World Innovation Award and the John Jordan Award for Excellence. And he's the first paramedic ever recognized as an honorary fellow of the Academy of Air and Surface Transport Nurses. Driven by a mission to elevate clinical practice worldwide, Eric has spent the last decade building FlightBridge Ed into a global leader in critical care education, making complex medicine accessible, practical, and high impact. Today, he continues that work as a researcher, consultant, and advisor, helping shape the future of EMS, transport medicine, and clinical education. And on top of that, Eric is a dear friend, so I'm super excited to have you today, Eric. Thank you so much for taking the time.
Hey, what a nice welcome. Great to be here and excited to share this podcast with you.
Yeah, absolutely. So Eric, you said that you had prepared a clinical scenario we can talk about today. So the mic is yours.
Yeah, obviously there's lots of calls that we've all had over our careers or patient interactions. I think, when you look at a call that I think matches this podcast and this style, I think about a case scenario that really highlights resource management and how to manage unforeseen difficulties on scene. So just real quick, tone for a head-on motor vehicle accident. And it was 2-vehicle head-on, 65, 70 mile an hour speeds. This is late December, bad weather. There was a lot of ice on the ground. It had just snowed and then froze. So getting up to this area, which was an area of higher elevation, was difficult. When we started heading towards the scene, we had about a 15-minute response time. In our area, it looked clear, so I put a helicopter on standby, just based on the information that we had. We arrive on scene. There was we were told by people on scene that there was potentially 4 patients, so there was a second ambulance also dispatched. They were coming behind us. They were about maybe 5 minutes behind us. We were the first unit on scene. Fire had got on scene at the same time. And one of the sickest group of patients that I've ever had. And so there was an immediate identification of a pediatric patient that was out of the car. Her mom was actually still in the car that needed to be extricated. She was also semi-responsive. She had a airway that was not being protected, so we had to think about RSI. Identified she had probably bilateral tension pneumothoraxes, had to deal with, and so there was a lot of stuff to deal with in a short period of time. And so I just want to talk about really, and based on your questions, the resources that we had available, and they were very limited. We realized as we extricated her out that the helicopter was overhead, but because of low-lying fog and the weather in the area, they could not land. So that resource now was headed back to their base. And so where we had a patient that definitely needed to go by helicopter, now I had to take by ground. And the closest hospital was a level 4 facility, where they would have been able to fly this patient to a level 2 facility. I was just dealing with the car with the mom and daughter. The other car was a car with just one patient that the other ambulance dealt with, and mainly had extremity fractures throughout.
And so when you arrive on scene, Eric, because, obviously you had a bit of time, you had some information, but you're not necessarily ready to know exactly what's going to be the status of these people. How do you split up just in terms of team dynamics do you assess each one patient? Do you decide whether you'll be 2-on-1 and then you had fire there to help you? I'm just curious how, and is that thought in advance, how you'll go through that?
Yeah, that's a good question. I think honestly, in most cases, you're working with partners that you're familiar with. I was actually working with my childhood best friend, so we knew each other. We were like brothers, and so I wouldn't have wanted to be with anybody else. He was an EMT intermediate, so I was obviously the higher level care on the ambulance. I remember, just talking about what we were going to do when we arrived. I tended to do a quick triage of the car we were going to. Um, and realized that the pediatric was already out of the car. Fire was attending to the pediatric. She was alert oriented. I could hear her talking. She had a patent
Mm.
airway. So I didn't spend any time with her. I went right into the car to mom. And that's where I found those catastrophic injuries.
Okay, that's interesting. But and you say that, but there's still some experience and some knowledge behind just noticing that one of the patients is probably okay. So going to assessing the other person. So then you both moved to the second patient. That's what I understand.
Correct. Both moved to the second patient. And when the other ambulance at this point, and this has been 20 years ago, I believe my partner stayed with me, right? And there was fire personnel that were on scene, pretty large volunteer fire department, but no paramedics, no other paramedics on scene. So at that point, until the other AMR ambulance got on scene, I was the only paramedic on that scene.
Okay. How does it change your mindset when you finally realize the helicopter that's right above you won't be able to land? Is that like how does that change your plan, but also how I'm sure that bumps up the stress level a little bit because then all of a sudden you have to kind of change where you were heading.
Yeah. Just based on the ambulances that we had at the time, at that point, you have to ask for more resources. So this is a county that had 5 ambulances on at once, 4 that were 24-hour stations, and then 1 that was a 12-hour station. And so immediately now you're asking for a third ambulance in a system that only has 5, right? Now there's mutual aid agreements with agencies close to that county, but it's not quick. And so, it just immediately flips everything upside down where you thought that you were going to be able to package this patient, get him off, then manage. You were going to go to patient number 2 at that point, and now your resource management is really put to the test.
That's interesting. Is that your resources and inside what you have as a team, also what you're going to require to get the patient to definitive care, like a mix of both of these things? Because obviously, I'm sure you're thinking ahead a couple of steps to know exactly how they'll get to definitive management.
Yeah, they all 3 needed a level 1 trauma center, right? They all 3 needed level 1 or 2. Obviously, level 1 is always better. There was no level 1s in the area. So they all needed to go to the level 2 trauma centers, every one of them, right? She was alert oriented, able to protect her airway. She had no airway trauma. It was all seatbelt injury from that deceleration head-on accident. But the other patient had significant orthopedic injuries in all extremities: tib fibs, femurs, pelvis, humerus. I mean, everything was broke. And so they all needed that level of care. Every ambulance in that county had a paramedic on it. But again, I don't even remember at this point was how many units were even available. I just don't remember. And like we could only had 1 unit available extra, and I'm asking for a third ambulance on one scene. So then you have to get a supervisor involved. The supervisor's probably coming to you as well. Um, I think the big thing though from a resource standpoint is for somebody to manage the scene. At the point where I was still the only paramedic on the scene, uh, I didn't even go over to the other car. I think I walked just over and I just looked. They were managing him. His airway was patent, but you have to stay with the most critical patient, right? I'm not going to start care on a patient and then abandon that patient and go to another patient. And that's hard. So, at this point, then you're dealing with your resources to say, all right, let's get all these patients extricated out on a spine board, right? They can do all that stuff. And then when those other units get on scene, then they can choose who the sickest patient is, who's going to go number 2, number 3 from an escalation standpoint, from a severity standpoint.
Yeah. Okay. That's super interesting. Once you, because you're taking care obviously kind of longitudinally with the help of other people that's helping get the patient out of the car. and obviously it's winter now. How does that affect the environment in which you're working? Like, do you need to get that patient in your ambulance as fast as possible? Does that change anything compared to how you're working normally? Like, how does the environment impact what happens?
Yeah, sure. I mean, I think that's I think there's a lot of safety stuff. Obviously, anytime you're working in the middle of a roadway, this is a busy 4-lane major highway, right? Making sure that you have apparatus stationed in locations that protect you. We're law enforcement's on scene. They've blocked traffic. There's no traffic getting in and out, right? So, because there are times where, I remember actually when we pulled her out of the car, we got the door open and we pulled her right onto a spine board and put her on the ground. I remember her airway was so bad. I had all the airway stuff right there ready to go. I almost intubated her right there on the road. And because of the weather and it had started snowing again, we moved her into the ambulance and I did it in the ambulance. And at this point, I had a 30-minute transport now coming off a mountain with icy roads, uh, uh, and so here's the other thing is my partner has to drive. So we had a difficult time getting a firefighter to be released from the scene because there was so much going on to where I could bring a first responder and EMT basic with me just for extra hands and assistance and help me bag. And I still had to RSI the patient and I did bilateral chest decompressions at that point. Um, so, it's managing that. It's managing the roads, talking to my partner and just letting him know to take it easy coming off the hill. Like, let's not, or, unfortunately, when patients are probably not going to make it, right? You're going to do everything you can, but I wasn't going to put ourselves in a situation where we're going to wreck or crash or kill ourselves, right? So just a lot of stuff that when you start heading for that scene, that everything changed once we got on scene.
Yeah. How many years into your career were you at that point? And I'm just curious because obviously, when you're 25 years in, all your experience, tells you, I need to think about this, I need to think about that, I need to. So, how early was that in your career? And was there anything like, why is that situation or scenario one that you remember? Was there something that you learned specifically, or that you got out of that
Yeah.
scenario?
Yeah, as far as my total career in fire EMS, it was like year 12. Yeah, year 12. I hadn't started flying as a flight paramedic yet. That was about 2 years later or a year and a half later. I don't know why that. I mean, I remember the day still, right? It's just one of those calls that stick with you. I think it was just how severely injured she was, and and again, just the resource allocation and how things just didn't go right. And you feel in those situations a little bit out of control, right? And you just have to overcome those situations and try to provide the best care for your patient.
What did you change or learn from that? Is there anything like the next call you had that was, with people that were severely injured? Was there something you did different? Did it change everything you do in a certain aspect of your work? How did it affect you?
Yeah, I don't know if it changed anything, Jeff. I honestly, I think it's one of those things that make you love the job, right? You love as stressful as it is, and when you reflect back, you're like, man, I wish it would have been a little bit easier. I think you like the unknown a little bit. I think medicine is like that. It's every patient's a little different. As long as you look at it pure, without bias, and do your job right, I think that's what makes medicine so amazing. Is every patient is a little different. There's always these little curveballs that are thrown at you. You have to solve problems. You have to stay calm. You have to, communicate effectively and ultimately get the job done. And you get the job done by working as a team. So I don't really know if it changed anything. I think it's just one of those things that you add to your list of calls that you can reflect on, and I'm sure you learn little things. That's what makes you better, are going through those motions and going through those situations, and so maybe you're a little bit more prepared to respond to the stress in the ever-changing environment.
And yeah, you say environment because obviously there's the whole medical part, but everything around it, like, you can't increase the temperature of the room. You're outside. You can't drive faster. The road is icy. Is that something that you learn, or is that something that you just come to know by experience? Like that whole environmental part, how do you deal with that?
Yeah, I think that's an interesting thought. I think you learn that obviously as you grow as an individual, right? As we gain perspective in life, we make mistakes, right? I don't know if you've ever hit black ice on a road, right? You do
Yep.
that one time and you never forget, right?
Yeah.
Because you feel out of control all of a sudden. And so it's just knowing your area. It's working in the same area your whole life or working in a service area. And I think that's where I have found when I have went and flown in areas as a flight paramedic in areas that I'm not familiar with. It's never the aircraft or the equipment or the even the partner I'm with. It's the local area. It's not knowing what standard weather is, the changes, not knowing where the hospitals are, not knowing the EMS agencies, not that is what gives me anxiety. There's a lot of comfort in working in the same area for a long time and just having that, knowing how the system works, knowing who fire is and just how everything's done a little different somewhere, right? So I think I think you just take those challenges and they start stacking up on each other, and that's what makes you a better provider. And so I think it's just perspective. I used this yesterday. I was on another video call, and we were talking about the difference between ALS care and critical care, right? And my analogy is this: how were we all when we were 18-year-olds? Right? We saw the world with blinders on, and now I'm 52, and I have a lot to learn still, but my blinders are way out. And that is all critical care is. It's knowing and looking at your patient from a much broader perspective and understanding things on a grander scale. And you're able to make decisions and maybe make decisions not to do something, right? Because you have a broader understanding. And that's a great difference between a paramedic and a physician. It's the same exact concept, right? Think about how many thousands of patients and thousands of hours you as a physician saw in residency and versus a paramedic, right? So it's exactly the same thing. It's comparing somebody that is a competent or proficient provider to somebody that's able to have intuitive decision making in most scenarios, right? And that's a physician, right? Paramedics can get there. It just takes a lot of freaking years, and you might be specialized in one specific area, not in a massive like emergency medicine. Think about all the things you have to know. So I just look at critical care the same way. I look at life the same way. I look at managing scenes the same way. It's you stack those experiences on top of each other, and that's what makes you a good provider and a good team member, right? Because I think it's more about situational awareness, and it's about crew resource management. It's about managing your resource correctly and team environment. That is a huge part of being a good provider. And I think if I had to say, if I brought a new paramedic student on the ambulance with me, my number one thing is they have to learn to manage their resources. They have to learn to manage the and delegate. They're not always going to be the one doing the procedure, right? It's no different than you as a ER physician or ICU doc, right? You're not always doing every single thing. Yeah, you might be doing a lot of the stuff if it's specialized, but you're guiding the process. You're running the code. You know what I mean? And so I think that is a key thing, operational effectiveness.
That's super interesting. Is that something that you learned in school or during your training, or do you find it something that you had to learn, like you had to gain through experience by either being coached or by going through these situations?
I definitely learned that in paramedic school during my internship time. I had a really good preceptor that I rode with through all my ride time, and he had very high standards. And I think for me, it was, he constantly pushed that he didn't want me necessarily doing everything. He wanted me to manage the scene, manage my resources, and delegate to everybody. And it was hard. I'm a paramedic student. I'm delegating to these firefighter paramedics that I'm working with what to do, and not, it's a way to do it, but, and so having the confidence to do that, speaking in front of everybody, and they're just standing there waiting for you to make a decision. That's all they want you to do is make a decision. And I think that's the key. That's the big difference. And so I learned that then, and I've used that same mindset on every student I've ever had.
And how is that? And that's a great segue into Eric. I wanted to talk about what got you to get so interested in education in general, and then starting everything you do with FlightBridge Ed, with the courses and the
Yeah.
podcasts and everything you do there. Is that mindset that you carried through and wanted to share that with other people?
Early on in my paramedic career, I always had an insatiable desire to learn, but there just wasn't a ton of stuff out there, right? It wasn't, technology has definitely changed things. And I was definitely fearful of speaking in front of people. I definitely was very fearful of that. I started teaching, ACLS classes and paramedic lab courses, and in paramedic school, and doing more lab stuff in small groups, and that slowly built my confidence, and got to a point when I was teaching a lot of outreach education for a flight company that started really realizing that I was getting some favorable feedback, learning constantly, trying to better and read the evaluations and kind of better that stuff. And honestly, what stimulated me or inspired me to start the Flight Brigade podcast was Scott Weingart. He is who really drove that for me and inspired me to do that. It took still 2 years for me to make the decision to do that. Initially, I didn't really know what I wanted to do, but once I figured it out and I wanted to do a podcast, I wanted to take the same concept that he used as his motto, is taking upstairs care downstairs. And I thought, why can't we do the same thing? Why can't I take critical care concepts and take them down to the ALS provider?
Hmm.
That was really the initial mindset and the mission, and it was never meant to become a business. I just wanted to record a podcast every 2 weeks and put them out and try to broaden our perspective as EMS providers. I definitely saw a big difference, flying into some of these smaller communities or smaller hospitals. You definitely saw a difference in how maybe patients were taken care of, and it wasn't that they weren't doing the very best that they knew how to do, but I also realized that, once a textbook is written, it's probably 5 years old already, right? Through the whole
Yep.
process. And so, the whole FOAMed mindset came out, Life in the Fast Lane, Weingard. There was another podcast called ICU Rounds by Jeff Guy, Vanderbilt, right? Those were the two podcasts that I listened to nonstop. And so it was kind of a culmination of all those things coming together. And then, meeting Evan Planch, our co-founder, and he had the IT ability to kind of build the platform, and the rest is kind of history, right? And just trusting that I could deliver the content and trying to prepare. And I read a lot of journals every month and a lot of articles and tried to just prepare myself the best I could.
And how do you find that people learn differently once they're actively working, like compared to when you're in school? Because you do a lot of stuff with people ongoing education, right? So, what's different in the way that you teach, or the way that you need that people get prepared, or is it easier because they have experience so they know what you're talking about, or is it different because they're getting older and they don't learn the same way? How do you adapt the education to these providers?
I have found that, when I did my doctorate in education, I found one of the best ways that we teach, and it's a natural way, is called the constructivist approach of learning. And essentially, that's just taking past emotional response to something and tying that back to a learning concept. So, doing a case study, doing a group exercise where you're talking about something that stressed you out, or tying it back to a personal emotional response in some way. Maybe it's a past call, maybe it's something that made you happy, maybe it's something that made you sad. We remember stuff like that. And so I think that's, to me, the best way to learn. And so that's why I think once providers are working, that's how we learn the best. Most people learn the best by doing and by relating that to a past emotional response. And so if we can do that, think about how many songs we know by heart. You can just start it, hear it, and we know it. And so it's kind of funny, when I hear people say, I can't learn, but then they can recite 30, 40 songs. You can learn. It's just not interesting to you, right? And so how can we make that emotionally interesting, where there's a tie? We all have a song that'll come on that'll take you back to your childhood or to your college years, or take you back to a certain time in your life, right? And so I think we can use that and teach in that same manner.
And do you feel that's interest, or is that really emotion? And just to kind of squeeze the difference, because a case can be an interesting case, but not bring up any emotions. Whereas, if you have a case that's very complex, and brings up a lot of emotion. So is it really the emotional response you're looking for when you say that it's easier for people to learn that?
I don't know if that's hard to judge. I think each person has to identify what that is, right? I think you just have to try to stimulate something in them that gives them perspective, right? Can you relate? And I think we got to be relatable. Education has to be relatable. And so how do you relate that? You relate that to something they've experienced. Because if you haven't experienced something, you don't have the perspective of it. And I think sometimes we're closed-minded to those things, right? And so I think if you can tie things back to something that they can relate to, I think we're better at remembering those things. And do I think there has to be interest? Well, sure, right. Think about even people watching TV shows and being able to recite movie lines and stuff like that, right? Because it's funny, or it's sad, or it's an emotional tie. And so learning, everybody can learn. You just have to figure out the best way to deliver that to where they attach that piece to it. And I think case-based learning is the best way to do it.
And so how do you enact that? You say case-based learning. Does that mean every concept that's presented in a class or a course has a case associated with it? How, or like, do you look for people in a room to tell their cases? How do you really use that concept during your courses?
Yeah, I mean, we've done either. Like sometimes I'll bring a case to the table, and then there's times where I'll talk about a flipped classroom, and I'll have them bring cases to the table, like split them up in groups. They come up with a case, and then we dissect the case, right? And you break down the medicine and break down the whys and the why nots and how we're supposed to approach that patient. And I think you got to be very careful to make sure you're objective, and you don't want to make people feel bad if they did something wrong, right? You got to approach it the right way. You got to say the right things, and because you don't want people to stop learning or talking, right? Um, so that's how we handle that.
What's changed the most since the first courses you give compared to the recent ones? And I know you've, iterated, you've written textbooks. What would you say is the thing that you've changed the most in your way of teaching from the first courses that you've teach and now the ones that you teach lately?
Yeah, I think probably, and this is no different than anybody else. I think, I mean, I bet I've taught 300 or 400 review courses, just review courses. That's not vent courses. That's not other things or lectures or whatever. So, there's thousands and thousands and thousands of hours. I think you just learn to have more of a command of the classroom. You learn to manage your time. You learn to not teach past your slides, right? I can tell somebody that doesn't know their content if they're teaching 4 slides ahead, right? Or are they having to look and read every bullet point? And so just being prepared, being able to read the classroom real well and watch your students and watch the facial expressions and being able to clue in that somebody's confused without them saying it, because a lot of times they're not going to raise their hand. So I just think those are the things you learn over years of teaching, and Flight Bridget is now in year 13. So um, I think writing content, writing lectures. There's so many things that you look back at things that you wrote 15 years ago, and I'll open an old PowerPoint I find. I'm like, geez,
Yeah, that's
you
normal.
thought it was good, but yeah, yeah.
And things evolve, and that's a good segue back to our case, Eric. I wonder, that was a few years back that you had this case. Obviously, I don't want to do the Monday morning quarterback, but if you had to have this case again with now the new experience that you've accumulated since then, is there anything you would have done differently? Is there a way that you would have managed the situation that would have been different? Do you think that because of everything you've seen, you might maybe have expected that the helicopter couldn't have landed? Or what do you think would be different if you had that same case today?
I don't really know on that case, honestly. I mean, I think we handled the situation as best we could. I don't know if I would handle it any different now. I think, just based on where the location of the accident was, higher elevation, unpredictable weather, where we were at in our local area when we launched the helicopter, it was perfectly clear and blue, right? So I was not anticipating them getting in a situation where there was going to be weather, but there was, it's a mountainous area and there was low-lying clouds and they just couldn't land. It just was unsafe. So I think it's important to always have a backup. I think I could reflect back and say that I should have probably thought that I needed to have a plan B. Maybe that's something I would change, is to make sure I have a plan B. But I have a lot of other calls that I can think back on resources or lack of resources or little things that I would definitely do different now. But we've come a long way from a technology standpoint, with equipment, with I mean, I've worked in I know your listeners, I've worked cardiac arrests and had to work cardiac arrest in the back by myself for 30, 40 minutes. I mean, how do you
Wow.
do that, right?
Yeah.
You're doing compressions with one arm, you're bagging with one hand, and well, you got to stop something when you're going to give your epi. What do you, right? So you try to bag up, and then you're doing compressions. Well, you got to use two hands. So you're stopping compressions. Well, you know that it's just so not having compressive devices, right? Things like that really does make a huge difference in patient outcomes. And I think there's just a lot of changes that we've seen over the years.
What's the biggest change that you've seen since the beginning of your career? What do you think is the biggest impact on either patient care or making the job easier in general? You said, I think, the automated CPR device is a great example. Is there something else that comes to mind?
I mean, there's a lot of equipment that makes it easier. I mean, just the power load gurneys nowadays. I mean, think about
Yeah.
how many backs are being saved. I mean, it's effortless. You literally push buttons, and it's two fingers, and you don't have to do anything. I mean, that's a huge thing. I think the technology, the cardiac monitors nowadays, I think, obviously end-tidal CO2 when it came around in the early 2000s was a game changer. There's just so much, right? We're constantly evolving and changing, having point-of-care ultrasound on the ambulances or the helicopters, and not everybody does, or point-of-care testing capability, and having EPOC or ISTAT machines, and being able to do, in critical care and trend labs and make better clinical decisions. And I just taught a critical care lab day the other day, and we were talking about that's the big difference, right? When you transition maybe a paramedic from a paramedic role in on an ambulance to a helicopter, and now they have point of care testing, or they have more tools, and then you take a nurse that's been in the hospital, that's always had labs, always had the information, right? And you blend those two disciplines together, it makes a great team. But it's hard. It's hard for the nurses, and we had some nurses that were talking. It's hard because they've always had information to make decisions. Paramedics a lot of times don't have that information. It's more off of minimal information. It's on gut instinct. It's on putting the puzzle pieces together, and you might have 10 puzzle pieces that aren't there. And so, but there's also issues with paramedics getting into critical care, and it's like, how do you how do you come together as a team and make better decisions? Information is king.
Yeah. And that's super interesting what you say, because a single scene, but for different people with different backgrounds, can just be so different. Someone can find, wow, this is so easy. I have so much information. And the other person can be really caught off guard because they don't have what they're used to. But putting these people together, then you'll get a nice mix of, strengths and weaknesses. So for sure, that's a very positive way to get the teams together. Concluding on the case, Eric, can you tell us a little bit? You made it to the first hospital you had. You said the closest hospital was a level 4 hospital. Is that what happened there?
Yeah, the closest hospital, level 4. We got her to that hospital. She was so catastrophically injured. I mean, she was so bad. She died in their OR. Daughter was able to be brought in, and then we transferred her to uh, the level 2, or she was flown out. I don't remember. But the other two patients were transported to eventually a level 2, and they could have been moved to the level 1 hospitals, but those would have been by flight,
Yeah.
probably
Okay.
fixed wing flight. Yeah,
Yeah.
yeah. But no, she did not make it.
And again, reflecting on that, obviously it wasn't the first case that you saw that was that catastrophic. How does that affect, the next day you need to go back, and is that changed in the short term the way you're, preparing for the next situation? Or, how do you feel going back? Or did you just go back to your next case and kind of jump back into it?
Yeah, I think so. I mean, and I've talked about this in some other podcasts. The next year, I had a point where I had a really rough year in 2003 with a lot of those types of calls, like dozens. Uh, and always having those calls, but they started really stacking up.
Hmm.
And came to a point where I felt like maybe uh, I I just couldn't handle it anymore. Uh, Took a couple weeks off, was really contemplating not being a paramedic anymore, which, I was pretty depressed. And this whole thing, I've talked on some other podcasts, really altered my path. And it was a conversation with my late father. He was a retired police officer, and called him and was sharing how I was feeling. And it's amazing how a dad can say the right things at the right time. He said this. He said, "Life is about free will. You can't control if a family gets hit by a drunk driver, or if a kid drowns in a pool, or somebody gets hit by a car. That's beyond your control. All you can control is, sorry, all you can control is how prepared you are to do your job. And as long as you focus on that, and you be the best version of yourself, and you critique yourself after every call, that's what you worry about." And Jeff, that is why Flight Jet exists. And since then, like when he said that to me, it flipped a switch in me. I immediately called my operations manager that quick. I said, "I'm ready to come back to work." I've never ever been bothered by a situation again, because I let that go. Yeah, it sucks. It sucks to see that stuff. It sucks to hear a mother cry for their child, right? It sucks, but I can't control it. I let it go. I don't dwell on it. I focus on my ability to take care of the patient. And so it was such a freeing thing that he said.
I love that. But at the same time, you come prepared. So obviously that's the big
Yeah.
difference.
Yeah.
Eric, finishing question for you, and thank you so much for taking the time. What makes you optimist for the coming years, or for what's coming for your profession?
I mean, I just love that we're in a place where learning is so accessible. I think there's a huge responsibility with that. I think there's a lot of people out on social media that I see all the time that give kind of bad advice, or maybe they're not teaching something correctly. So I think that's a problem. I think you got to be very careful in making sure that you follow the right people, and that you validate that stuff, that ultimately podcasts like the Flatbridge Ed podcast, or um, is lower than observational studies, right? As far as hierarchy of evidence, it's expert opinion. You just got to make sure that whoever's talking about that stuff knows what they're talking about. You can trust them, and that it's backed by, hopefully they're backing it by evidence. So I just think, I try to focus on what we at Flatbridge Ed are going to do, and keep pushing the boundaries, and keep raising the bar. And I think, you're going to see that continue, where, EMT basics, when I was an EMT basic, are learning things that I never learned. Right. So I think we can continue to raise the bar in each of the levels. And I think that translates to hopefully more tomorrows with our patients.
Awesome. Looking forward to seeing that, Eric. Thank you so much
Yeah,
for taking the time. I really appreciate it.
absolutely. Thank you for having me.